In part one of this interview, Dr. Varma discusses where we learn macroscopic pathology, and it's certainly not from our attendings. And since the attendings don't come to the grossing room, can we bring the grossing room to the consultant?
Why do you think macroscopy is so critical?
Uh, because even the most expert pathologist can only assess what has been sampled for histology. So if an abnormality is missed on macroscopy, it will always be missed on microscopy. The other point is that with microscopy, you can have retrospective review. So if something is missed on microscopic examination, you still have another chance later on review. But if something is missed on macroscopy and the specimen has been discarded, then those findings are lost forever.
In that case, what steps do you think institutions and professionals can take to ensure that macroscopic examination is given the necessary importance and attention, especially in pathology training and in practice?
Yeah, I think as part of the problem, and this is everywhere, it's universal. In my own training, I know when I was a trainee, I learned most of my macroscopic examination protocols and techniques from my senior trainees, not from my consultants. So I missed out on the experience that the consultants had. To do a proper macroscopic examination, you have to know what the final microscopy report needs. And that often comes with experience. So which is why I think that consultants need to be more closely involved in the macroscopy. I understand that in busy departments, it can be difficult for the consultant to spend time in the cut-up room. But if it's difficult for the consultant to go to the cut-up room, then maybe the option may be that we have to be innovative. The cut-up room has to come to the consultant. So by which I mean is we could potentially, in this age of digital pathology, have a video camera above the cut-up bench, so that when a trainee is doing the cut-up, simultaneously the pathologist in his office could see, could help, and then that could be recorded. So you don't have to keep the recordings for a long time. You can keep the recordings for a short while. And from those recordings, you could then take screen grabs, photographs, which could then be recorded, kept as a permanent record. So there are different ways where the pathologist could be more closely involved with the cut-up.